Welcome to your neighborhood pharmacy on Dunbar Street. Today, we're joined by Dr. Pourya Eslami, a pharmacist with extensive experience in the field.
First of all, my name is Pourya, and I graduated from UBC in 2021. I bought the pharmacy about 3 months ago, and before that I was a pharmacy manager working in Victoria, BC.
How was the transition like getting this pharmacy?
Transition, I would say, was tough because, first of all, finding a good pharmacy in a good location is generally hard. This pharmacy, however, I got lucky in a way because the owners were amazing people. The location of the pharmacy is great, but they were thinking of retiring. Just luck had it that at the same time I was transitioning back to Vancouver from Victoria, and I managed to buy the pharmacy from them.
How did you become a pharmacist?
So for me, it was like a uncommon route. I started university around 16. I was in Amsterdam actually at the time as an international student, and I was studying business and management. And when I came to Canada, I decided to pursue a path that involves business and medicine, and that's why me going towards pharmacy, especially towards the end of my bachelor's degree, I was thinking of ownership from the very beginning. So I'm really glad that that came to reality.
This cross-disciplinary actually works very well.
Exactly, because what I learned in Amsterdam as an international business management studies student is a lot more have to do with like bigger companies and like the hierarchy and what the complexities will be. But obviously you'll be using the same tools and the learnings that you do during that time to apply it in pharmacy or any other field, I would say, where there is a team that you're working together.
What would you say are important skills for this career?
For the pharmacy, honestly, I can simplify it to just one word. This is how I thought about it. It's just communication. If you're good at communication, if you know how to understand what you're being told, whether that's in university, whether that's your patients, other professionals in the field, and you can convey your point to them, I would say you'd have an easy time in any field, but particularly pharmacy, because it has a lot of social aspects to it. So obviously, in terms of medical knowledge, you should know your stuff, but going through university, you essentially get filtered out on that front. So you basically, you are tested on your knowledge or like your learning skills, your critical thinking. Then after that, I would say even in pharmacy, medicine, or any professional school, then it becomes hard work, communication, and I would say passion as well about the job and about what you're learning. Because if you combine like a good communication and being passionate about something, I think that just like is a recipe for success in any field, but pharmacy as well. Yeah, exactly.
Yeah. What would you say are your main roles as a pharmacy owner?
Right now, I'm working as a pharmacy owner, as a pharmacy manager, assistant, technician, and pharmacist. So it's just like I'm everything in one right now. So when you start a business, especially like me, when you don't have much of a support in terms of like ownership itself, financial support you might have from your parents, from the government, from the banks, but then for people whose parents are entrepreneurs, they do have that support. For example, they know the taxing system, they know the accountings of it. But for me, I had to learn all of that on my own. I did learn some of it during my time being a manager in Victoria, but then when you do it all by yourself, it's a different ballgame. And so as a pharmacy owner, I would say I have to know taxing system, I have to know accounting, I have to be a good communicator. Because now I'm not just talking to my patients and other pharmacists or the medical staff. I'm now talking to accountants, talking to lawyers, I'm talking to the bank and a banker, and they communicate differently. Like for example, the material that I had to sign or review for the legalities of buying a business, it uses a whole different language. So that you have to become familiar with and have, I would say, the resources to rely on when things get tough or challenging in a way. And that's the pharmacy owner part. Taking trash out is part of it, but you don't have an assistant, it's just like cleaning, that's part of the pharmacy ownership as owner or entrepreneur as well. But then it becomes like more into details. Like seasons are different in pharmacy. Like winter is a lot more busy than summer, so you have to anticipate that COVID season, flu shots, and all that. People get more sick during winter, especially with upper respiratory tract infections. It's a supply-demand thing, so you have to provide enough staff or have enough hours in your mind that you are working to, in a way, fulfill the demand that you're going to be having. I would say not having an ego really helps, I would say, because as I said, having an ego, just like as an owner, you would not be able to do the things you do, because in the beginning things are completely messy. You do have to be creative and do everything on your own until things get on track, and then you can delegate those tasks. But in the beginning, it's just, it's tough, it's difficult.
How about telehealth? What are your thoughts on that?
I mean, I have it here. I brought it here. I actually implemented here in the pharmacy. We do have telemedicine here. Telemedicine was great. The patient gets to talk to a physician same day. So there is always that consult that the patient gets. Now, depending on where the patient gets that telemedicine service, it's also important. There are telemedicine services where the patient can reach out to the telemedicine company, sort of a thing, directly. And in that sense, the patient just gives a general idea of what they are experiencing, and then the physician reaches out to them. But if the patient comes to the pharmacy and I can't assess the patient myself, and you know there is like the expanded scope of practice for pharmacists where we can assess certain medications, so certain conditions, and now in a month or so we'll be able to, we are recognized as referring practitioners for lab requisitions. So those are happening, and if I can't assess that patient or provide prescription or treat that condition, then the next thing that could happen would be telemedicine. So the history of the medical condition, the history of care, and then they pass that on to the telemedicine. So now the telemedicine doctor has a much more comprehensive list of like symptoms, characteristics, onset, history of everything that has happened to the patient, previous medications they've tried or they're taking right now. So then that telemedicine physician would have an easier time treating the patient.
Yeah, it sounds like it's alleviating pressure off of family doctors.
100%, yeah, that's the whole point of like really the minor elements that came to power in a sense, and also telemedicine. It's just because, again, we're going more towards an interdisciplinary practice, we're trying to also alleviate the pressure that we are all experiencing. It's not just physicians, also pharmacists as well, or nurses, but when we work together, the pressure just gets spread out, and that way we are helping each other, one way or another.
As an immigrant yourself, are there any challenges you encounter transitioning to Canadian healthcare system?
The Canadian healthcare system? Well, I kind of knew a little bit about the Canadian healthcare system before coming to Canada, and I was already an international student back in Amsterdam in Europe. At that time I got to know different health systems, but Canada's was a lot more clear than the Dutch system. Yeah, I would say so. And the other thing I would say, the main problem I could have seen, I would have, was language. And I didn't have that. That's why I managed to actually go through the Canadian healthcare system quite easily, because at the end of the day it comes back to communication all the time. Just learning about it was quite fast in the beginning. And at the time we didn't have the problems that we have right now, so the moment I went to a family physician office, she became my family physician, and to this day she is my family physician.
What would you say is a misconception people generally have with this career?
Well, I would say the biggest misconception is that we just dispense pills. I mean, historically that might have been the case. Even historically, we were referred to as chemists, I've heard. But it's not just dispensing medications. Of course, dispensing medication is like a procedure. It's not like I pick up the medication and give it to you. There is like, you have to check for interactions. You have to check for the indication of the medication. Is it a proper treatment? Is it the right dose? Is it the right duration? So in a way you have to know all the treatment algorithms to be able to dispense that medication. But then it's not just that. There is conditions that we are assessing. 21 in BC, but in other provinces there is even more. So we're gonna hopefully see an expansion in that. We are now considered referring practitioners, so in a month or two we'll be able to write lab requisitions. So now the practice is becoming a lot more comprehensive in terms of like provision of medical care. It still revolves around medication, but now we're using more skills that we've been taught. I mean, in UBC, I would say I learned more about clinical parts of like medicine, say for example, treatment algorithms, even diagnoses, the goals of therapy and all that, rather than actually the chemistry part of it. So knowing like the exact organic chemistry, which we all did in our undergrad, like methylations and SN1, SN2 attacks and everything. Like you learn those things in your undergrad, but they don't necessarily get emphasized as much as the clinical stuff in pharmacy school. So that's why there is a transition in the field as well. And that's why I went to pharmacy in the beginning as well. Like there was talks of the things that are happening right now while I applied for pharmacy school, because we are, I think, the second batch of doctor of pharmacies. The first graduating year, I think, was 2020, and then us being the second batch is 2021. So anyone before that, at least graduating from UBC, they're bachelor of pharmacy. Not that they don't have the necessary like skills or skill set, and we always get updated on those. But my point is now the focus of the faculty, and for this change necessarily, is because now we're being trained more clinically. That's why you're seeing like the field being expanded, or you see like more tools being given to us to use. I'm glad that the government is following up with that, and they're doing a great job, and they're seeing the results. And we're not the first province who's doing it, so we have great examples to look at and do it better, I would say, like, moving forward.